Welcome back to another edition of What's Next? Living Longer, Better, Smarter. Today, amazing innovations and Alzheimer's awareness. You'll want to hear about a recently FDA-cleared blood test, and we'll meet another great caregiver helping to change the world in our Spotlight segment with Carrie Yaya. I'm Fred Fishkin along with Mary Furlong, and this episode is made possible by our friends at Brava. Mary, with summer here, one of the things I'm liking best about this remarkable countertop oven that cooks with light is how it doesn't get hot on the outside, and that helps to keep the kitchen cool during the hot weather. This is really amazing halogen lamp cooking, and they heat up instantly. And the Brava really can cook just about everything from toast and eggs in the morning to whatever you have on the menu for dinner. And the unique way it cooks with light allows it to cook different foods to different temperatures all at the same time. You put asparagus on one section of the tray, roast potatoes on the next section, and then a couple of chicken breasts, and they still come out right. It has a bright color screen that downloads tons of recipes to guide you along, or you can use the Brava app.
And I really love the safety features. Like you said, it doesn't heat up on the outside. It turns itself off when it's done cooking. My stovetop doesn't do that. And the app can be shared with family members who can check in to make sure older loved ones are eating right and doing okay. Those are among the reasons why Brava is an enterprise participant in the Age Tech Collaborative from ARP. Cooking with the Brava is pretty amazing.
And we have a great deal for our audience that you can let your friends and family know about too. You can get $200 off any of their groundbreaking ovens by going to shop.brava.com/marycooks. I'll say it again, shop.brava.com/marycooks.
That will lead us to our first guest from another company that is focused on innovation.
Withings is a company based in France that has been a pioneer in using technology to help us all get healthy and stay healthy. And we're happy to have joining us the Director of Sales and Marketing for the U.S., Paul Buckley.
Hi, Fred. Thanks for having me.
Paul, we so appreciate you taking time to be with us on our podcast. Before we talk about your brand new innovation, let's give everyone a little bit of background about the company. You should know I'm an evangelist for your company. You've been taking a very serious approach to digital health devices for quite a while, right?
Yes, thank you, Mary. Yeah, yes, the company started in 2009, and most people know us as a smart scale brand, but we're much bigger than that. We're based out of Paris, France. And starting in 2009, maybe the reason why they know us as a smart scale brand is we invented the smart scale. So that was our first foray into the connected health, which was a very early time for that category of products. Most people don't even know about them today still. So back in 2009, it was still the Wild West, so to speak. And Withings was paving the way here to provide daily health data for people who really wanted to take charge of their health. So we started with scales. And we branched out from there into blood pressure monitors and then sleep tracking mats, and then obviously back into wearables and tying it all together through our app. So we've been selling our products now at mass retail and as well as on our website. So we're very easy to purchase our products no matter where you shop.
I have to say, Paul, your smart scales and smart watches designed to keep a lot of the technology hidden, those watches are really well done and innovative. And you've had, as you mentioned, blood pressure monitors on the market before, but now you got something new called the BPM Vision, which makes it
Yes.
easier than ever to monitor and track blood pressure. Give us the overview.
Sure. We just announced our BPM Vision at CES this past year and brought it to the market in the past few weeks. It's a new tabletop version. So our previous blood pressure monitor that's still on the market works with your phone and also has a screen on the side of it. But we found that there was a large group of people that had a hard time seeing. I'm wearing glasses right now. If I didn't have my glasses on, I might have a hard time seeing those numbers too. Now, although it does go to your phone, we also found there was a large population that was having trouble with just working smartphones. So we took the best of both worlds. We created a tabletop version that has a large screen. So you can see a diastolic and systolic readings right there. And also, it's color coded. So even if you don't understand what those numbers mean, 120 over 80 is not necessarily perfect health for everybody. Everyone's different. But what it will do, it will give you color coded based on like street lights, yellow, red, green. Red being not great, green being good. So you would be normal green, you would be elevated at yellow, and then you would have hypertension one, hypertension two, and then hypertension crisis. And what's good about this is that you can take your blood pressure and everything's fine, and all of a sudden you see the colors start to change. And as they change, you should. Your behavior should change. You should do something different. Maybe you've walked up a flight of stairs or you had a cup of coffee before you did your blood pressure reading. That can affect it right there. And we will ask you questions, we'll prompt you that. If you said no to that, then maybe there is another issue going on, and you would want to share that information with your doctor, and you can easily do that through the Withings app. And the reason why I said we took the best of both worlds here, you can see everything on your tabletop version, but it also all that information day after day, week over week, month after month is going to your phone. So that report that you share with your doctor will have a longitudinal reading of all your health meetings.
So maybe you can step us through how it's used and tell us why this is so important.
Well, I mean, the rise of hypertension is almost like half of American adults right now are suffering from hypertension. I believe 25% of them are dealing with it and working with it, but the number is increasing. And it's almost going to be at a point where maybe a few years down the line, I'm sort of um, thinking this may be the case, but like the way we brush our teeth every day and take care of dental hygiene, there's going to be cardiac hygiene, where you'll be essentially measuring your blood pressure on a daily or weekly basis. I mean, that's the first indication of cardiovascular disease, and it's something that you can prevent if you have early warning. One of the things that Withings is trying to do and is doing every single day to the millions of people that are using our products is give them the early warning notice of something happening, trending differently in their health. And that's where they can share that information with their doctor. None of Withings products detects any disease state, and nor am I a doctor. But what we do is show trends in your health and how you can share them with your doctor and really prevent something that could be really terrible happening.
And when it comes to the actual usage of this in the household, you can have multiple people using it, right? I mean,
Yes. So most of our products, with the exception of the wearables, which I'm wearing now, which is for one, most of our products are all for 8 users.
wow.
So you can have multiple people using the product. You just sign in on the app and let them know that it's you.
And it's really simple to set this up and use it. You've got that color display really on the BPM Vision, besides working with the app. So I mean, the usage is really easy. So just give us
It's
a quick step through.
It's extremely easy. You just open it up right out of the box. You download the app with it and just asks a few questions, your name, your sex, your height, and your weight at that point. Actually, for this product, it wouldn't ask you for your weight. And then once you pair with the product, it just takes the readings right away once you prompt it to take a reading, and it's going to take 3 readings for you, and then it will take a blend of that reading and let you know what your overall blood pressure is at that point. And I should add that this product is FDA cleared, and all Withings products that have a cardiovascular component to it are FDA cleared, and it's also FSA and HSA eligible for people who participate in those programs.
Now, you've announced the beta release of something called Withings Intelligence.
Yeah.
You're not fixing my brain, I assume here, but which is a new feature for your Withings Plus subscription service. Tell us about it. This is using AI?
Yeah, so AI is all the rage, right? And what AI is great, AI can go out there and gather all the information and sort of like bring it all together in one place. That's not unlike what we're doing here, but the difference is my health and my body is different than Fred, yours, or Mary and yours. So all the readings that you're getting by either using our blood pressure monitors or our wearables or stepping on the scale every single day, the AI component is going to bring all that together and show any correlation to trends, whether they be positively or negatively. And then at that point there, you also have an AI chatbot built right into our app. And that app, you can ask that chatbot if there are any suggestions what to do to better your health, whether it be change your diet, reduce, increase your exercise, or any other piece that will help improve your trends in your health.
So that sounds really exciting. And wait, let me stop. Three, two, one. That sounds really exciting and will it work with a range of your devices?
Yes, it's called App 7.5 and it works with all Withings devices. And it will only work, though, however, with Withings Plus. So, Withings Plus is an upgrade to our app and it's a subscription-based model. And it's $5.99 a month, just a short amount of money. But then in there, you're able to use the 7.5 app intelligence. And also in Withings Plus is really great with any of our cardiovascular products. We have cardio checkup. So cardio checkup is $49 a month. And what you can do is send all your ECG readings, whether it be with our wearables or with our body scan, and have them sent to a cardiologist and have them read within 24 hours and sent back to you. Try to find an appointment with a cardiologist within 24 hours. It's very difficult. And so if you see some reading, whether it be on your BPM vision or on our body scan or through one of our wearables, and you're very concerned, within 24 hours, we offer this opportunity to speak with a cardiologist.
Do you want you ads? Tell us about your lineup.
Our lineup of products. So I glossed over them real quickly, but we have three scales, three smart scales. The first one is Body Smart, um, and our next one up is Body Comp, and then our third one is Body Scan. All of our scales provide your weight and they provide your muscle mass with your BMI, which is a very basic reading that was around for years, but we've even taken that to the next level and added cardiovascular to our scales. So our scales, although they are it's scales, they have a heart component on every one of them. Starting with Body Smart, you'll get your heart rate. With Body Comp, you get your vascular age, which is the speed of your blood up to your heart and back. And so we're going to know whether you have arterial stiffness, and that is going to sort of give the indication of maybe you have clogged arteries or whatnot. Again, you need to share this information with your doctor. And then when you get to body scan, you're able to get a six-lead ECG. So that's in 6 points with your arms and legs, um, two on your hands and one on your on each foot. And this way, it'll get a 6 point ECG electrocardiogram to share with your doctor.
Just amazing. I know there's more to come, Paul, something called BMO and something else called the UScan
Yeah,
Nutrio.
I brought a BMO with me.
Tell
Uh,
us about that. This is really almost Star Trek stuff, it sounds like.
yeah, I mean, this is BMO here. BMO, as you can see, fits in the palm of your hands. And with uh with my fingers right now, I'm going to be able to do an ECG right here. Also, at the same time, it'll be able to read my blood oxygen level. This product also has a digital stethoscope. So this has allowed me to listen to my heart and my lungs and be able to make a recording to share with my doctor. And then also, it's a digital thermometer. So it's a four-in-one multi-scope. We released this, talked about this at CES 2 years ago, and it's right at the precipice of FDA clearance. Once this gets FDA clearance and FSA eligibility, it'll be brought to market as early as hopefully early summer.
And tell us a
Wow.
little bit about the Nutrio.
So that's also a product that's coming this fall. Nutrio is going to be able to measure within your urine, you have 3,000 metabolites. And in there, we can measure your ketone levels, your acid and alkaline levels, as well as your hydration levels. and your vitamin C levels. And that is something that we're going to bring to market starting in the fall. This is something that goes into your toilet, and you can have this home urinalysis at the comfort of your home. It's really easy to do, and all the information, again, goes right into the Withings app, and you can share that with your doctor.
You know, I was with a ICU doctor yesterday, and he was telling me how important it is to be able to diagnose a UTI. So I
Yes.
think that could go a long way with that and save medical costs. As if you could figure that out early, you can deal with it at home, hopefully.
Absolutely. That is the goal of that product. Once we roll out Nutrio, we will roll out subsequent cartridges that can measure different metabolites that's going on in your urine. And you touched upon something that's important. Withings is all about trying to bridge the gap between today's healthcare and the patients, and what we're trying to do is get out and be more of a preventative force for people to take charge of their life and their health.
I really see that you have big opportunity in home care and senior housing, as well as with the consumer. So, Paul, the innovations at Withings are amazing and really can help us live longer, better, smarter. Thank you so much for being with us, and we look forward to all that's coming.
Thank you so much, Mary.
The website for more is Withings, WITHINGS.com. Mary, our next guest is focused on educating us all about the early symptoms of Alzheimer's. Dr. Carl Hill is with the Alzheimer's Association, the Chief Diversity, Equity, and Inclusion Officer. Thank you for joining us.
Oh, thanks for having me here, Fred.
Dr. Hill, we appreciate you taking time on our podcast this morning. We're talking about an important and urgent health issue affecting so many people. Can you put it into perspective for us?
For the first time, yes, Mary, and thanks so much for having me. More than 7 million Americans are living with Alzheimer's. And Alzheimer's is the sixth leading cause of death among people aged 65 years and older. We estimate that the lifetime risk for Alzheimer's dementia at 45 is 1 in 5 for women and 1 in 10 for men. And so this is a public health crisis, and we know that we've got to get people resources so that they can protect their brain health and reduce their risk for Alzheimer's or another dementia. And so the association is really proud to partner with the Ad Council to develop this Some Things Come with Age campaign. And this is urging people to learn the early signs and symptoms of Alzheimer's disease and other dementias in their loved ones, which can often be mistaken for normal signs of aging.
Right, if you forget something, right?
Right.
So tell us about early detection. And are there some new advances like the blood test recently cleared by the FDA?
Sure. Yeah. Early warning signs could be having, trouble following a familiar recipe or, keeping track of monthly bills. Anytime you see a loved one struggling with familiar tasks or frequently forgetting, important dates and names, it may be, a sign for you to have a conversation. Good resources on 10signs.org around having and starting this conversation. And so that's critical and important. As far as the blood test, we are really encouraged by this development, because it will enable earlier diagnosis, so it's even more reason to know the signs of Alzheimer's so that you can have a conversation, an informed conversation, with the doctor and get a timely diagnosis as soon as possible.
Now, I understand that the blood test measures 2 proteins associated with Alzheimer's. What are your thoughts about the need to have the test covered by insurance plans, maybe even Medicare?
Yeah, we advocate for people to have access to, all of these important FDA, approved treatments, particularly, something like this important blood test. And we just released a facts and figures report, Fred, a couple of months ago where we surveyed Americans, nationally representative data around their perception, of Alzheimer's. And we found that almost 80% of people want to know if they have Alzheimer's disease, and they want early access to testing. We found that people want medication to slow the progression of the disease, and that they'd accept some risk if it meant slowing, progression. And then we also found that people are optimistic about new treatments. And so, given this optimism, given the fact that people are now informed of these new treatments or maybe some lifestyle modifications to protect brain health, we think it's important. We advocate, for coverage for FDA approved treatment so that people can have access and reduce their risk and protect their brain health.
So, what can you tell us about any advances in treatment?
Well, it's important to understand, modifiable risk factors. I tell you, it's one on one hand, lifestyle is so important, and so research is telling us that almost 45% of global dementia, could be preventable. That's what that's what the Lancet Commission said. And so getting information to communities about what's good for the heart is good for the brain, getting people information about things that they can do to reduce their risk and protect their brain health is so critical and important. And then, for the first time, Mary, as I'm sure you know, we're in a place now where we have treatments that slow that cognitive decline. They're not cures, but they're disease modifying treatments. And so the important, part of this is that, they are for people in early stages of the disease, right? And so, it's important for people to know what to look for, to detect so they can get a timely diagnosis. Otherwise, you miss the window for these, really, revolutionary new treatments. And so it's important, I think, to get people information, to be in community, to provide, this information in an equitable way. And that's why we're so just honored to partner with the Ad Council to get this information to communities, all communities, and think about ways to get this information in an equitable way to some communities who may be disproportionately affected.
Right. And many of us wonder what's normal, what isn't when it comes to signs of aging. You touch on that in the Ad Council messages, and we're going to show that in a minute. But I guess the question is, if there's doubt, what should people do?
Fred, if there's doubt, it's never too soon to have a conversation with a doctor. And there are typical age-related changes, like making a bad decision once in a while, sometimes forgetting which word to use. We all do that on our journey in our aging process, but there are specific signs of Alzheimer's and dementia, like, withdrawal from work or social activities, decreased poor judgment, misplacing things and losing the ability to retrace steps, and so having more information about, what these differences could be, can really help in starting the conversation with a loved one, in that step to talk to a doctor and to potentially get, a diagnosis, and a diagnosis here is important, because it's a diagnosis of exclusion, really taking a look at, overall health, cognitive, tests, things that could rule out Alzheimer's or dementia, or, substantiate a diagnosis and get people the treatment that they need. And so it's never too soon to have a conversation with a loved one about some of these signs and symptoms, and with a doctor, to get the help that you need.
So, I understand there are increased risk of Alzheimer's among Black Americans. Do you know why?
We don't know fully why, Mary, but research points to differences in life experiences or socioeconomic indicators, which link to people's access to important resources. or higher rates of health conditions like cardiovascular disease and diabetes. Research is telling us what's good for the heart is good for the brain, right? And because Black African Americans are disproportionately affected by cardiovascular disease, it challenges, brain health and puts, them at risk for developing Alzheimer's or another dementia. Another important part here is, just receiving a diagnosis. Black African Americans are less likely to receive any type of diagnosis for Alzheimer's and dementia. And that's why we think, these PSAs, this work that we're doing with the Ad Council to include Black African Americans in the PSAs, so that, these communities can see themselves in an equitable way, feel included, and we can deliver, these messages and drive people to 10signs.org in a way that's equitable so they can take action and protect their brain health, get quality care, treatment for themselves and for their loved ones.
Well, let's take a look at one of those public service messages.
Derek! Derek! Go wash up and grab your sister.
Okay, but first.
What's that?
Tiny, it's a little bear.
Yeah, we'll get the little bear. You see those? That's how we gonna make that pie.
Really?
Now that's a sweet potato pie.
Yep, Mama, I did that.
Where's Grandma?
It's Hey, Mama. Ma.
Hey, baby, when did you get here?
I just got in.
Oh, good to see you.
How you doing?
I'm good.
Good?
Look who's here.
What's up?
I'm worried about Mom.
Mom? She's fine. These the ones, right, Mama?
Yeah. Groundlings.
Sweet potatoes.
Sweet potato.
You all right?
Yeah.
That's how we gonna make that pie.
Daddy, it's salty.
Grandma's just getting old. Some things come with age.
And some don't. You ain't ever put no salt in a sweet potato pie, Mama.
Just want to get you checked out because, we think it's important. We love you, Mama.
Love you so much, Mama. I love you too, baby.
Early detection of Alzheimer's can lead to better care for your loved one.
That's 2 eggs?
Yes, it says two, Grandma.
Learn the early warning signs at 10signs.org.
Tell us about the importance of this campaign.
Well, as we mentioned, Black African Americans 2 times more likely to have Alzheimer's or dementia, and we know getting people resources is critical in this fight to reduce disparities in Alzheimer's and dementia. And so we're really excited to work with the Ad Council here. This new creative educates, pre-care partners by focusing on core memories, made with older family members, while emphasizing why it's important to have a deeper understanding of the early signs of Alzheimer's. We really believe by highlighting subtle signs like, again, trouble completing familiar tasks or frequently forgetting important dates or events, that these PSAs will raise awareness around the cognitive and behavioral changes that aren't normal aspects of aging.
So, where can people go for more information?
Well, at 10signs.org, you can learn the early warning signs of Alzheimer's versus what's considered, signs of normal aging. The site also contains resources on tips, for facilitating conversation, discussions around cognition, benefits of early detection and diagnosis. And there's also a discussion guide for use with doctors and health providers and other information. And as always, Fred, if you need immediate assistance, you can call us at the Alzheimer's Association 24/7 helpline at 1-800-272-3900.
Well, thank you for the amazing work you're doing, Dr. Hill, and thank you for spending time with us.
Thank you for having me, Mary and Fred.
Again, the website is 10signs.org. Time now for what is becoming one of our favorite segments, our Spotlight with Care Yaya and founder Neil Shah. Care Yaya is a groundbreaking platform for caregiving that uses healthcare students from colleges all around the country to provide care. Neil, what's the latest news on your growth and who have you brought with you for us to meet today?
Great. Yeah, thanks, Fred. Thanks, Mary. Great to see you guys again. So really exciting developments on our growth, all across the board. We've expanded into 5 new geographies, the caregiving platform itself. We've won a grant from the National Institute on Aging for our Voice AI Companion project to help older adults with loneliness and isolation. And then we've also just won a big A2 collective grant on the project we spoke on your podcast about a few months ago, Counterforce Health, the AI-powered appeals engine to help patients and clinics fight denied health insurance claims. That came through my alma mater, University of Pennsylvania, and the National Institute on Aging. So really excited for several of Care Yaya's social impact projects to be out in the world, making an impact, helping thousands of people. And here today, we're featuring Hari, who has really been foundational in building the early days of Care Yaya's presence in Dallas. And I'll turn it over to you to give your introduction.
Thank you, Neil, and the Care team for giving me this opportunity. Y'all have honestly done so much for me, and I don't know how to repay you back besides expanding the mission into the Dallas area. Thank you, Fred and Mary, for allowing me to be on this podcast. It's not every day that a college student can be on a podcast, so it's truly an honor to be here.
And you've been in pre-med at the University of Texas, Dallas?
Yes, sir.
Hari, I'm so excited to meet you. We'd like to learn more how you ended up working with Care Yaya and some of your experiences so far.
So I actually joined Care Yaya late of April through Handshake, which is a college, application site. And even though it's been a short amount of time, I feel like the connections and experiences I've made through this opportunity make me feel like I've been doing it for more than a year. I feel like the special thing about caregiving compared to other pre-med jobs like EMT, scribe, medical assistant is that you get a direct opportunity to be part of someone's life, take care for them, make them feel valued, make them feel special. And I feel like you can't get that in other pre-med jobs because you don't really spend that much time with the patient. And I think one beautiful thing that I've learned about caregiving that I didn't really know before is that there's moments where you can tell the family is getting more comfortable with you and learning to trust you. And for me, that moment was when I was taking care of the family I take care of now. I was helping the grandma walk to the room, just making sure she was safe. And I was just expecting her to do her work or something, but she gave me a jewelry from her cabinet and she was like, "Here, keep this." I was like, no, I don't want it. But she was like, "No, you need to keep it. I wish I adopted you. Like, your mom did a good job raising you." And in my mind, I'm like, I did nothing to deserve this because at their house, I don't really do any major work besides, just talking to them, making sure they're safe, light housekeeping duties. but to them, just doing that stuff genuinely just means a lot. And to be able to experience those moments and, have it as a pre-med, it truly means a lot, and I'll remember it forever.
Was there any particular inspiration that you had for wanting to get involved with Care Yaya, and what impact might all of this have on your career, do you think?
So for me, whenever I look for opportunities, I always look for impact and am I making people feel better? So for Carrier, that this is a direct opportunity to do that because you directly go and talk to people when you just hear about their life, accompany them, just make sure they're safe, do light housekeeping tasks, and you get to be part of their life. They trust you once you're, taking care of them. I feel like there's a lot of wonderful moments that you'll experience and stuff that I've experienced that I'll remember forever. And one thing for me was it was the family I'm taking care for. Their grandma's birthday was recently. And when I first joined, I made sure to ask for their birthdays like non-directly just so I can plan for it ahead. And the grandma's birthday was first. So when her birthday came, I asked the patient advocate, what is she like? So I got her flowers, I got her favorite food, which is Chinese food. I got her a card and I got her the cross necklace because she really likes cross necklaces. And in my mind, that's like the bare minimum because everyone deserves to have their birthday celebrated. And obviously, she was really happy. And then after that day, I was like, okay, it's over. The next time I came, she held up the card and she was like, "Here, you see this? I hold this really close to my heart." And stuff like that. It's like I don't expect it because in my mind, I'm just doing the bare minimum, but to them, it means so much. And to know that that means a lot to her, the fact that she keeps it on her walker all the time, it's kind of hard to explain how much that means to me. And I feel like this has a big impact on my career as a physician because some people might say caregiving and medicine aren't like directly related, but I would say there's a strong similarity between both because for physicians, they see a number of patients every day and they see these patients for a small amount of time and they might not even remember them after a while. But for patients, the way the doctor treats them, the way the doctor serves them, the way the doctor listens to them, just acts towards them, they'll remember that for a long time and it'll affect how they leave the hospital, the clinic, or whatever. And I feel like for caregiving, it's the same. Like I do 4-hour shifts. So it's a small part of my day. So after the caregiving shift, I have no classes, college, work. But for them, it means a lot. It's a big part of their life. The way I treat them, the way I act towards them, the way I care for them, the way I talk to them, they'll remember all of that for a very long time. So being able to make them feel good and make them feel trusted make them feel, comfortable in my presence, I think it hones my skills as a physician because you have to do the same for patients.
So tell us what's next for you.
Next, there's a lot of exciting and scary things. Scary, MCAT, and I also have med school labs, but we'll see when we get there. But for exciting, I'm starting a club next semester at UTD for Carrier with my friends and some other Carrier people. And something I realized through the process is that, I obviously have Carrier people. I have people that are healthcare that are my friends, and some of my friends that aren't healthcare. So it's special to see everyone on every category helping because it truly shows how, there is no specificity on like who helps. Anyone can help. Anyone can contribute to the mission. And it makes me happy to see that everyone's working with me, to help expand this. And I honestly couldn't do it without them. So it's been a fun process throughout.
So Neil, thank you for the great work you're doing. You're really creating a caregiving community in ways that really change the game, and it's quite inspiring.
Thank you, Mary. Yeah, no, it's really awesome. I mean, I think it's awesome to find and empower people like Hari to, kind of bring and build the community in new regions. And, we feel like the whole thing works because it's a grassroots movement. The people kind of that are going out caring for people in their community are then helping expand it. The people that are getting help through Carrier are then telling others. And I think it just builds a totally different vibe. So I think the intergenerational relationships is like the best part of the whole thing that, beyond just the care experience. I really loved what Hari said about spending only a few hours with someone, but it makes a profound impact on their lives. I think one, not only is that positive to do in the moment, but two, I think that often shapes people's careers, and that could have a positive impact 10 years from now, when Hari's like practicing medicine and remembers kind of those experiences, remembers, hey, this is the way people feel based on what I say. I think that that bedside manner is like a critical skill in developing in people, whether they become physicians, nurse practitioners, physician assistants, et cetera. So I think, yeah, that's really awesome.
I was going to say, Neil, you set out to improve caregiving, and you've been doing that dramatically. But at the same time, maybe you didn't anticipate how much you may have changed our future physicians in the way they see their patients.
Yeah, no, you're right. I think it's been like a kind of a unintended positive, effect of, what we initially set out to do. And actually, I was reading a book on social entrepreneurship, and it's great. I would highly recommend it to all you guys of how to change the world. And it kind of came in the early days of the social entrepreneurship movement. But I think that's really sometimes when you kind of just set out to change the world for the better, and you're like doing it out of like purely social mission, a lot of like unintended second and third order positive things end up happening, like exactly, Fred, what you said in this case. And I think that's really awesome to see.
I'd love to know the name of that book. And I just heard after our conference last week, the phrase servant leadership. And so I used Chat GPT to say, what's a servant leader? You should try that, Chat GPT with you as servant leader. But I love the notion of bringing back caring communities, servant leadership, and this multiplier effect, because those are the things that really will always make a difference when you touch people's lives. I think, Fred, you're right about that. I also think you've got a workforce that's very tech enabled now. So age tech can be infused in this group much easier than other groups, I think.
Yeah, totally agree.
The website is careYaya.org. We want to thank both Neil and Hari. We want to thank Dr. Hill from the Alzheimer's Association and Paul Buckley from Withings for sharing their information and innovations with us. Thanks too to our sponsor, Brava, maker of the amazing Brava ovens that cook anything with light, safer and smarter. Don't forget you can get a $200 discount at shop.brava.com/MaryCooks. I love that. And of course, we appreciate all of you for tuning in. Remember, you can find all of our episodes at maryfurlong.com/podcasts.